is Rihanna Fonseca, the founder of Atlanta Endometriosis Community. It is Adenomyosis Awareness Month, April. So I did want to go ahead and talk about adenomyosis quite a bit so that we could go ahead and shed some light on it, as it is not as talked about as endometriosis. Adenomyosis is kind of known as endometriosis' evil twin sister or like evil cousin. Some people even call it like endometriosis of the uterus because it kind of mimics the same thing. They have a lot of similar symptoms. Adenomyosis is defined as tissue that is growing within the myometrium of the uterus. So you would see here that this is a normal uterus that is perfectly healthy, what it looks like, and what a uterus looks like with adenomyosis. In this picture, the patient has diffuse adenomyosis. With diffuse adenomyosis, you'll see that you have like blotches throughout the uterus versus focal adenomyosis, where there's just like one huge bulge of adenomyosis. In my case, I have the focal adenomyosis, that's one huge bulge, where my uterus measures almost twice the size of what a uterus is supposed to measure. So that is how you would differentiate between the two. Like one is like splotted throughout the uterus versus one being a huge collection of tissue that is making the uterus enlarged. Some symptoms of adenomyosis is that you'll have extremely heavy bleeding. You'll see that your female counterparts might have like super light periods, and you might say, oh, I'm just weird, I might have a heavy period. A lot of the times that's not the case. A lot of the times it is adenomyosis. People do often get diagnosed with endometriosis and they stop there, or some people don't even have endometriosis but they have adenomyosis. It's very common to have both of them. But with adenomyosis, you'll notice the main difference is that you'll have like a heaviness of the uterus. Like you'll feel like if you're like dragging a weight around almost. And you'll have a lot of heavy bleeding, lots of blood clots. Mind you, not everyone experiences these symptoms, but these are the most common symptoms that you'll notice. In my case, I was 14 years old and I passed out in high school due to anemia from a lot of blood loss from my period. I was having a lot of heavy bleeding. And the first thing that doctors do is that they'll say, oh, okay, a patient has heavy bleeding, let me give them some birth control. They'll automatically assume that is a hormonal balance before they explore other issues. Like instead of saying, hey, what is causing this hormonal balance, they'll just start prescribing birth control and kind of use you as like a lab rat or a guinea pig and just try different birth controls and different medications, trial and error, until something works. And this can be very exhausting for patients. So definitely what I do encourage as an adenomyosis patient myself is to go like the natural approach. By what I personally do is V-steaming. So you're sitting over a pot of herbs that is steaming up into your uterus. Some people, they go against V-steaming, saying that the uterus is supposed to clean itself. Well, I personally have found that when I do V-steam, my symptoms are a lot better versus when I don't do it, I have a lot more issues. A common issue with adenomyosis is a lot of odor and darkness to the blood. This is because the blood is basically storing in those pockets. Like And those blotches that you see in the picture, like picture those as like blood reservoirs almost. Like your blood is just like pooling there. So like it makes your period a lot heavier. For some people it'll make their period longer. And you may notice an odor to it because that blood is just like sitting there. And it also gets old, which is why it turns a darker color. It's just a lot of different things that it's just like paying attention to your body. You have to like really like, you know, it may be gross, but you do have to like look in the tissue or look in the toilet and see, like keep up with what's going on with your period. Like pay attention to the different colors throughout your period. Pay attention to the different smells. Pay attention to if you're having like itching or where your cramps are located at the time of the month, or if you're having painful bowel movements, if you're having bladder issues, nausea, dizziness, like all these issues, they correlate with each other. Like I notice when I am bleeding extremely heavily due to adenomyosis, like I'm overly exerted, like any little thing I do and I'm just like breathing, like if I just like ran a mile or something, like just like almost hyperventilating. And also I get dizzy a lot, lack of appetite, getting diarrhea, constipation, nausea. Again, a lot of these symptoms, they overlap with endometriosis. So it's very important to like go and, you know, get checked. Unlike endometriosis, it's a lot easier to kind of suspect that you have adenomyosis. You could check to see if you have adenomyosis sometimes as simple as an ultrasound. In one of my ultrasounds that was transvaginal, they found that I have adenomyosis. They showed an enlarged uterus, and it said that it was like suspect of adenomyosis. And I also had several pelvic MRIs that showed that I have adenomyosis as well. But I do want to say that the only way to be positive that you do have adenomyosis is by getting a hysterectomy and then getting a biopsy of your uterus. And that is the only true way of knowing that you have adenomyosis, but until then, they can only suspect it. Unlike endometriosis, adenomyosis does have a cure, and that is a hysterectomy. But if you're like me, being 25 years old, being unmarried, or if you're just not ready in life, whatever the case is, you know, a lot of us, we don't have kids yet who have adenomyosis. So having a hysterectomy is a little bit unrealistic for some of us. Like in my case, like I'm just literally fighting every single month, like dealing with my symptoms to try to get to the point that I'm able to like have a child and then eventually get my hysterectomy. Like that's my plan. Like that's my ultimate goal. I'm hoping that when I get my hysterectomy, that since my adenomyosis will be gone, that most of my pain will be gone. Of course, the bleeding will be gone since I won't have a reproductive system for the most part anymore. But I am concerned that endometriosis, of course, will still be there, and like just seeing what that pain is like by itself versus having adenomyosis and endometriosis. I think that's pretty much all that I wanted to cover. A lot of attention is brought to endometriosis, which I totally go hard for. As you can see, I have like endometriosis gear, and I started Atlanta Endometriosis Community, and I am an endometriosis advocate. But I did want to say the importance of also speaking up about adenomyosis as well. It is April. I know that we have all been quarantined, so we haven't really been like rocking our purple and yellow like we typically do for Adenomyosis Awareness Month. But at least we could do something. If it's as simple as sharing a post or sharing your story, definitely just try to open up so that we could get some awareness about this condition so that hopefully we could get a better treatment strategy. Oh, I do want to mention that if you are trying to avoid having a hysterectomy, a good option for you if you have focal adenomyosis, which is the big bulge of it, is to try, I think it's called uterine artery embolization. It's UAE procedure. It's not a surgery. It's a procedure that you could like basically go home with a band-aid. Dr. John Littman here in Atlanta, he specializes in it. He is located at the Atlanta Fibroid Center. Basically, the procedure involves the doctor going in with a catheter and using something to like block the blood supply for the adenomyosis, so the adenomyosis would like die off. So it's like another strategy of avoiding having hysterectomy by just having this procedure done that like shrinks down the adenomyosis until it disappears. So that is an option. Look into UAE surgery. Look into Dr. Littman. He is a very talented doctor. I went to go see him, and he's very educated about endometriosis, adenomyosis, and fibroids. He would be able to distinguish the difference between you having fibroids or adenomyosis or endometriosis or PCOS. He's a very great resource to basically identify between all of the conditions. And if you have, for instance, some people do have fibroids and endometriosis or fibroids and adenomyosis. If that's the case, again, he's a very skilled doctor to see. Also, of course, the Center for Endometriosis Care here in Atlanta, as well as Dr. Sayini Hawkins. She is also a fibroid doctor, but she also specializes in endometriosis and adenomyosis. So definitely look into Dr. Hawkins as well. She is a Black female doctor with endometriosis and fibroids. So it's definitely awesome to see a doctor that has a patient's perspective. I just wanted to share that. This is our flyer for Atlanta Endo Expo, which we had to postpone several times, that I was going off of. We will have these at our event for the attendees, and eventually when we start selling packages and sending those out to different countries, we will try to kind of like redesign these so that they could be sent out as well, so that those people have the info to share with people as well. Alrighty, so happy Adenomyosis Awareness Month. I know it's not so happy because it's an absolutely miserable condition to live with, but I do hope that you ladies who are holding out for babies stay strong. Those who are holding out for hysterectomy, stay strong, keep fighting, stay on top of your iron and your vitamin D and your natural herbs so that you could try to get some relief. Rihanna signing off.